Hello, my name is Riley Johnson, and I will be presenting over the impact of global health on healthcare systems. By the end of this presentation, the audience should be able to understand the relationship international health has on the national, state, and local health, synthesize data and evidence to enhance the effectiveness of international health programs to improve the health of an affected population, and understand the importance of global health. Global health is an area for study, research, and practice that places a priority on improving health and achieving health equity for people worldwide. As you can see to the right here, I have created an image that international health, national health, state health, and local health are very interconnected and related. It's really important to know that disease and health inequity do not follow specific geographical, political, or cultural boundaries. Diseases do spread faster nowadays because of air travel. In history, they used to spread by sea travel, but now since air travel is more common and many people do it across the world, this is how diseases can spread very quickly. Additionally, we have an increased awareness of diseases and the spread of diseases because of social media. If you think back to COVID-19, the initial start of it, we knew as soon as the first case in Wuhan, China, became a national and international thing that we knew very quickly because of social media. And for international and local health, you want to think globally, but act locally. Many of the problems that we see within our national, state, or local boundaries are actually problems that can be affected globally, and solutions can occur that impact other countries as well. Local health is global health, and finding those solutions locally, statewide, or nationwide can be considered those global health problems and solutions if we put it in the perspective of a global health situation. International health on the US healthcare system is going to be the next topic we will talk about here. So the US government takes the international recommendations and creates laws that can mandate or enforce behavior. So for example, the World Health Organization, or WHO, is an international organization that creates those recommendations. The US government then takes the recommendations of the WHO and creates laws within our nation that we must follow. And we voluntarily do that. The US government is voluntarily a relationship or a partner with WHO, and so when they have recommendations that come out, we put them into perspective into our national laws and enforce behavior. So we will focus throughout this presentation on COVID-19. It is very important that we understand how the international health is really related all the way down to our local city's health. So COVID-19, the first case started in Wuhan, China in December of 2019. It was the very first unconfirmed case that we had of someone presenting with abnormal pneumonia or respiratory symptoms. And so internationally, the World Health Organization declared a pandemic on March 11th of 2020. This is when the cases began to rise, deaths from the situation became increasingly high, and so the World Health Organization at that time declared it as a pandemic. Now, how did we as the United States healthcare system respond to that? So we took the recommendations of the World Health Organization and essentially began to shut down the nation. States individually had when they decided to shut down their states and the government. But on March 15th of 2020 is when most states began to implement those shutdowns. We took the World Health Organization recommendations and nationally enforced behavior to promote social isolation and quarantine if having symptoms, essentially just to improve the health and prevent the spread of the United States citizens. Now, if we think on international health within the state or within Iowa here, we can focus on COVID-19 and how Iowa responded to it. So based on the nation's or the US laws that were implemented for shutting down the states and quarantine, Iowa implemented their shutdown right around that time of March at the same point. Also, there was mask mandates. So you had to go out in public with a mask, and you had to quarantine if you had any symptoms, and social distancing. There was times where there cannot be groups together within 6 feet of each other of greater than 10. Essentially, at this point, the United States was providing each state with money and resources, and Iowa would allocate our resources appropriately to be able to improve the health of its citizens. Although, if we fast forward 2 years, at that point, the United States did not have any specific shutdown or mask mandates. So after 2 years, Governor Kim Reynolds signed the last extension for Iowa's public health disaster emergency proclamation, like I said, for the last time. She stated, "We cannot continue to treat COVID-19 as a public health emergency indefinitely. After 2 years, it's no longer feasible or necessary. The flu and other infectious diseases are part of our everyday lives, and coronavirus can be managed similarly." This was huge after 2 years. At that time, there was certain variants of COVID beginning to occur within the community and internationally. But after 2 years, the governor decided that we need to continue to move on with our lives and can no longer live in this disaster emergency state. So at this point, again, vaccinations were spread internationally and the variants continue to grow, but the overall health of COVID was, we were beginning to live our lives a little bit more normally, whatever that normal tended to be at that time. But it was a huge change for Iowa, and that was, like I said, within the Iowa boundaries. Now, Illinois, Minnesota, Michigan, all of the states around us or in the nation had different laws that they had at that time. We are able to do this because the United States didn't have anything at that point that we had to follow as Iowa. So Governor Kim Reynolds was able to create her last extension of this law. Now, if you go down the chain, the nation's laws are the top priorities. Every state has to follow them. Every city has to follow them. But if there isn't a national law, then you go to state. If a state doesn't have a law, then you go to locally. What does your community have for its rules and regulations? That sort of thing. But the nation's is the highest point where everybody has to follow, and then it trickles down from there. Lastly, we're going to talk about international health on the University of Iowa, or my local area and where I work. So when COVID-19 started, initially the University of Iowa was like essentially shocked, right? There was frequent changes and we didn't really know what to expect. If you can see that picture to the right there, this is actually one of my coworkers in the emergency department. That is what we looked like walking around the hospital with the mask, eye and face shields. And when you walk into a room, most of the time you had gown and gloves for contact precautions as well. We did not know much about how it was going to affect us initially, but we knew that people were dying, and it was a very dangerous illness to contract from others. So throughout the time of COVID in those 2 years, changes frequently occurred with visitor rules. How many people could come in? Could they have any visitors at all? Could visitors stay overnight in the hospital? This changed frequently. There was never the same thing, or sorry, never the same rules within the hospital for, I would say, more than a few months. It was changing drastically and quickly. Also, testing of COVID-19 patients. This changed less frequently, but we were err on the side of caution as a hospital and as a community, and we were testing all of our patients for COVID-19 for a very long time because we couldn't risk exposing others when they were not showing any symptoms, especially because there are dual rooms, shared rooms in the hospital. So we needed to test everybody, and whoever had COVID-19, whether they had symptoms or not, were placed on 1 or 2 units. And then if anyone else did not have COVID, they tested negative, they would go to other units. So no one was being exposed. We were also for a while testing people or patients in the hospital every 3 days after admission, just to be sure that they weren't developing any positive tests after their admission. And lastly, staff screening. That changed rapidly as well. In the beginning, all staff were being screened before they walked in. Essentially what it was, did you have cough, fever, shortness of breath, any of those symptoms? If you do, you shouldn't be at work. We didn't want to risk exposing anybody. And if you don't, you scanned your badge, and that essentially was your, no, I don't have any symptoms and I'm okay to work today. So those are changes and rules within the hospital. Their policies, they change very rapidly. But if, like I said, if the state did not have a specific law at the time, so for example, when Governor Kim Reynolds lifted all of the emergency mandates from COVID-19 in March of 2022, the University of Iowa continued to mandate masks within the hospital at all times. There was a point where they did take it off. If you were within an office and not in direct patient care, you could take off your mask. But like I said, that was pretty fluid, and the mask mandate essentially continued until March 8th of 2023, so just recently, 3 years after the first time that the United States closed and shut down, essentially. So 3 years after the pandemic went on, essentially, is when the University of Iowa decided, with lower numbers of COVID going on, that it was okay to lift the mask mandate within the hospital. Now, what does the future have to say for this? Nobody knows, but if cases continue to go up for safety of others, I'm sure it'll come back, something like that. But so the University of Iowa locally, they have different policies that they implement based off of what the international, national, state, what their actual laws, rules, and regulations are. And every single city or community has different ones as well at this point. This is just focused on the University of Iowa. Also, the increased rate of vaccinations is very high at the University of Iowa and in the community. That picture as well of my coworker, Dave, he was actually the first employee at the University of Iowa to receive the COVID vaccination. So that's a picture of him there. But it's just really important that based off of the community's well-being, what kind of policies, rules, regulations, laws there are. So in summary, global health is national, state, and local health. It's all interconnected. If the targeted local issues have a global health impact, if they attempt to understand the issue as a global health perspective, or seek a global health solution, it is a global health situation and it can be seen as global health overall. And we can learn from all different locations and levels of healthcare. As we can see, we can learn locally, from state, from nation, and from international standpoints. We can learn from other countries, and other countries can learn from us. And lastly, local initiatives have global health consequences, whether good or bad. Like I said, diseases and health inequities do not stay within certain boundaries. It can move throughout the world. If anybody has any questions, feel free to reach out to me. There are 2 slides here of my references. Thank you so much.